Look at your neck right now. Go ahead. If you see deep horizontal lines creasing across the skin there, most people would tell you that's just aging. Most people would tell you to buy a better moisturizer, to sleep on a silk pillowcase, to try a collagen cream. But what if those lines have nothing to do with how old you are, and everything to do with what is happening deep inside your body right now? What if those wrinkles were your body's way of waving a red flag, trying to warn you about something your doctor hasn't mentioned yet? In the next 15 minutes, you are going to learn what medical research has quietly been connecting for years, the relationship between the condition of your neck skin and the health of your liver. Stay with me, because what you are about to hear could genuinely change how you think about your health for the rest of your life. Most people in their 40s, 50s, 60s, and beyond look in the mirror and see wrinkles as the enemy of beauty. They spend billions of dollars every year on creams, serums, and procedures trying to erase what they believe is simply the passage of time. But aging alone does not explain why two people of the same age can look so dramatically different on the outside. It does not explain why some 70-year-olds have luminous, firm skin, while some 45-year-olds look exhausted and deeply lined. The difference is almost never purely genetic. The difference, more often than not, lives in the internal environment of the body, and specifically in how well the liver is doing its job. The liver is the largest internal organ in your body, and it is one of the most extraordinary. It performs over 500 documented functions every single day. It filters your blood. It metabolizes everything you eat, drink, breathe, and absorb through your skin. It produces bile to help you digest fats. It regulates your blood sugar. It manufactures proteins that your blood needs to clot properly. It detoxifies alcohol, medications, pesticides, and hundreds of other chemical compounds. It stores vitamins and minerals. It regulates hormones. It is, in every meaningful sense, the engine of your body's chemistry. When that engine is running cleanly and efficiently, the entire body benefits, including your skin. When that engine starts to struggle, the signals show up in places most people never connect to. Liver health, the neck, is one of the first and most telling of those places. Here's why the neck skin is particularly revealing. The skin of the neck is thinner than the skin almost anywhere else on your body. It has fewer oil glands. It is exposed constantly to the elements, to sun, to gravity, to the mechanical stress of movement. Because it is thin and relatively fragile, it is among the first places where internal biochemical changes become externally visible. When the liver is compromised, even mildly, several things happen to your skin chemistry that directly accelerate the formation of lines and wrinkles, especially in the neck area. Understanding that chain of events is what gives you the power to do something about it. The first connection is through what scientists call oxidative stress. Your liver is responsible for producing and recycling a molecule called glutathione, which is your body's master antioxidant. Glutathione is the compound your cells use to neutralize free radicals, the unstable molecules that damage cellular structure and break down collagen and elastin, which are the proteins that keep skin firm and smooth. When your liver is under stress from poor diet, from excess alcohol, from environmental toxins, from chronic inflammation, or from conditions like non-alcoholic fatty liver disease, its ability to produce and recycle glutathione drops. Significantly, when glutathione levels fall, oxidative stress rises throughout the body, your skin cells take damage faster than they can repair themselves. Collagen breaks down, elastin loses its snap, and the thin, vulnerable skin of your neck begins to crease and fold in ways that have very little to do with your age on paper. The second connection runs through your liver's role in hormone metabolism. Your liver is the primary site where hormones are broken down and cleared from your bloodstream. Estrogen, testosterone, cortisol, insulin, all of these are processed and regulated in part by liver function. When liver health declines, hormone metabolism becomes inefficient. One of the most impactful consequences for skin is what happens with estrogen. In both men and women, estrogen plays a critical role in maintaining skin thickness and moisture. It stimulates collagen production and keeps skin hydrated. When the liver cannot clear and recycle estrogen efficiently, hormonal imbalances develop that directly thin the skin and reduce its ability to hold moisture. A liver that is struggling is one of the hidden drivers behind skin that looks older than it should, particularly in areas like the neck where the skin was already working with less margin. The third connection is through bile production and fat absorption. Your liver produces bile, which your digestive system uses to break down and absorb dietary fats, including the fat-soluble vitamins A, D, E, and K. When liver function is compromised, bile production and flow can become sluggish or congested. This condition, known medically as cholestasis, means that even if you are eating foods rich in vitamin A and vitamin E, your body may not be absorbing them efficiently. Vitamin A is essential for skin cell turnover. Without it, skin becomes rough, dull, and prone to premature wrinkling. Vitamin E is one of the most important antioxidant vitamins for skin protection. A liver that is not producing healthy bile is quietly starving your skin of the very nutrients it needs to stay smooth and resilient, regardless of what you are eating. The fourth connection is through inflammation. A compromised liver releases inflammatory signals called cytokines into the bloodstream. Chronic low-grade inflammation is now understood by researchers to be one of the most powerful accelerators of aging, a process sometimes called inflammaging. These inflammatory signals circulate throughout the body and activate enzymes called matrix metalloproteinases, or MMPs, which degrade collagen and elastin in the skin. They also disrupt the skin's natural barrier function, making it harder for skin to retain moisture. The result is skin that thins faster, wrinkles deeper, and loses elasticity more rapidly than it should. And because the neck skin has the least structural support of any commonly exposed skin area, it shows this damage earliest and most visibly. Now, here is something that many people find deeply surprising. The connection between the liver and neck skin is not new territory in medical observation. Traditional Chinese medicine mapped what practitioners called the liver meridian, running, along pathways that correspond to the neck, jaw, and throat. Ancient Ayurvedic physicians noted connections between yellowing or premature wrinkling of the neck area and what they described as liver heat or liver congestion. While these traditional frameworks use different language and conceptual models, the observation itself was consistent across thousands of years of clinical tradition that the neck reveals the liver. Modern functional medicine and dermatological research has been quietly catching up to this observation. Studies examining patients with diagnosed non-alcoholic fatty liver disease consistently show higher rates of premature skin aging, particularly in the neck and décolletage area. The mechanism is now understood. The signal was always there. But this is where the message shifts from concern to empowerment. Because unlike genetics, unlike chronological age, unlike many of the factors that influence how you look and feel, liver health is one of the most responsive systems in the human body to lifestyle intervention. The liver has a remarkable capacity for regeneration and recovery. Given the right conditions, liver cells can repair themselves. Liver function can improve measurably within weeks of targeted dietary and lifestyle changes. That means that the changes you see in your neck skin, the ones that have been worrying you, may not be fixed. They may be reversible, at least in significant part, by giving your liver what it needs to do its job properly. The first and most powerful thing you can do for your liver is to reduce your consumption of refined sugar and high fructose corn syrup. So fructose, unlike glucose, is metabolized almost entirely in the liver. When you consume more fructose than your liver can process, which is easy to do in a modern diet filled with sodas, juices, sweetened yogurts, packaged cereals, and processed foods, the liver converts the excess into fat and stores it. This is the beginning of what doctors call hepatic steatosis, or fatty liver. You do not need to be a heavy drinker to develop fatty liver. The sugar in your pantry is doing the same work that alcohol does in the liver. Reducing added sugar, particularly fructose from processed foods and sweetened beverages, is the single most impactful dietary change most people can make for their liver health, and by extension, for the quality and appearance of their skin. The second intervention is to increase your intake of cruciferous vegetables. Broccoli, cauliflower, Brussels sprouts, kale, arugula, and cabbage all contain a compound called sulforaphane, along with indole-free carbonol and other glucosinolates that have been shown in clinical research to directly support liver detoxification pathways. These pathways, specifically what biochemists call phase 1 and phase 2 liver detoxification, are responsible for breaking down and neutralizing the toxins, hormones, and metabolic waste products that circulate through your blood. When these pathways run efficiently, the liver does its job faster. Glutathione levels are better maintained. Inflammation is lower, and the skin reflects that internal cleanliness. Eating 1 to 2 servings of cruciferous vegetables daily is a meaningful, evidence-backed strategy for improving liver function over time. The third strategy is to support your liver with bitter foods. Bitterness is a flavor that modern Western diets have almost completely eliminated. Yet bitter foods, dandelion greens, radicchio, endive, artichoke, gentian root, and bitter orange peel have been used across virtually every traditional food culture, specifically to support liver and gallbladder function. Bitter compounds stimulate bile production and bile flow, which improves fat digestion, supports fat-soluble vitamin absorption, and reduces the kind of bile congestion that contributes to sluggish liver metabolism. One of the most accessible bitter liver tonics is dandelion root tea, which you can find in most health food stores. Drinking 1 cup of dandelion root tea in the morning on an empty stomach is one of the simplest things you can add to your daily routine to support better bile flow and liver function. The fourth strategy is to prioritize the mineral silica in your diet. Silica is a trace mineral that plays a direct and underappreciated role in collagen synthesis. Foods rich in silica include oats, millet, leeks, green beans, cucumbers, and horsetail herb tea. Silica is specifically needed for the cross-linking of collagen fibers that give skin its firmness and resistance to wrinkling. While silica alone will not overcome liver-driven oxidative stress, Addressing it as part of your overall approach ensures that as your liver function improves and collagen-destructive processes slow down, your body has the raw materials it needs to rebuild skin quality from the inside. The fifth strategy is to be intentional about reducing your toxic load. Your liver processes every chemical compound that enters your body. The higher the volume of toxins coming in, the harder the liver has to work, and the less capacity it has for other critical functions. Practical toxic load reduction means choosing organic produce for the items most heavily sprayed with pesticides, particularly apples, strawberries, spinach, peppers, and grapes. It means switching to personal care products and cleaning products that do not contain synthetic fragrances, parabens, phthalates, and other endocrine-disrupting chemicals. It means being cautious about over-the-counter medication use, particularly acetaminophen, which is metabolized exclusively in the liver and is one of the most common causes of liver stress in the general population. Every reduction in toxic input gives your liver more bandwidth to do its regenerative work. The sixth strategy is to address sleep quality as a liver health intervention. This connection surprises most people, but the liver follows a circadian rhythm just like the rest of your body. Research in chronobiology has established that the liver does the majority of its regenerative and detoxification work between the hours of approximately 11 at night and 3 in the morning. This is the window during which liver cell repair is most active and the blood filtering process is at its peak. If you are consistently staying up past midnight, or if your sleep quality is poor due to sleep apnea, anxiety, or other disruptions, you are cutting into this critical liver recovery window every single night. So protecting your sleep, particularly sleep before midnight, is one of the most underused strategies in liver health, and by extension, in preserving the quality of your skin as you age. The seventh and final strategy worth addressing is the role of hydration. Your liver uses water as part of virtually every metabolic process it performs. The bile it produces is primarily water-based. The blood filtering process requires adequate plasma volume. The lymphatic system, which works alongside the liver to carry cellular waste out of tissues, depends on adequate hydration to keep moving. Chronic mild dehydration, which studies suggest affects a significant portion of adults over 45, quietly impairs liver efficiency and contributes to the kind of sluggish detoxification that shows up as dull, wrinkled, prematurely aged skin. The standard recommendation of 8 to 10 glasses of water per day remains solid guidance, but quality matters as well. Adding a squeeze of fresh lemon juice to your morning water provides a dose of citric acid and the compound D-limonene, both of which have documented liver-supportive properties and help stimulate bile flow first thing in the morning. There is one final essential point to make before closing. The symptoms of declining liver health are often quiet and gradual: fatigue that builds slowly over years, skin that gets drier season by season, digestion that becomes a little less reliable each decade, brain fog that you attribute to stress or age, and weight that settles around the midsection despite no obvious change in diet, and wrinkles, particularly in the neck area, that seem to deepen faster than they should. And none of these in isolation will send most people to a doctor, but together they paint a picture of a liver that is working too hard and receiving too little support. The good news is that you do not have to accept this trajectory. The liver is not an organ that gives up easily. Given reduced toxic input, improved nutritional support, better sleep, and consistent anti-inflammatory eating patterns, the liver responds. Liver enzyme levels normalize, inflammatory markers come down, bile flow improves, hormone metabolism becomes more efficient, glutathione levels recover, and the skin, including the skin of your neck, begins to reflect that internal recovery. Skin does not change overnight, and some structural changes from years of oxidative stress may be permanent. But the rate of change slows dramatically. The quality of new skin cells that your body produces improves, the moisture barrier strengthens, the visible aging process genuinely, measurably decelerates when the liver is given what? It needs to function at a higher level. The wrinkles in your neck were never just about time. They were a message written in the language of biochemistry, in the dialect of oxidative stress and bile congestion and hormonal imbalance, transmitted through the thinnest, most honest skin on your body. Now that you can read that message, you are no longer powerless in front of it. You have the knowledge to respond, and responding with intention, with consistency, with the strategies you have just learned is where the real transformation begins. Your skin is waiting for your liver to be supported. Your liver is waiting for you to begin. If this information opened your eyes to connections you had never considered before, there's a great deal more where this came from. The kind of health knowledge that goes deeper than symptoms, that looks for root causes, that gives you practical tools instead of vague reassurances. That is what this channel is built around. If that resonates with you, subscribe to Dr. Thomas Ellison right now, and make sure your notifications are turned on so you never miss what comes next. Your health deserves better than surface-level answers, and that is exactly what you will find here.